let's talk about another medication you're going to want to know for your boards. This is not Monday, it's Tuesday, but we're going to dive in and talk about aminoglycosides, okay? This is a class of medications that you are going to want to know for your school and for the board. So let's get right into it. So what is aminoglycoside? It is a classification of antibiotics, okay? You've heard of these before: gentamicin, neomycin, clindamycin, streptomycin, vancomycin, right? These are antibiotics. These are the big boys. These are when infections cannot be treated, right? They're drug-resistant antibiotics for drug-resistant infections. They're considered a bactericidal, and we use for major infections, okay? Brain hack, enzymycin, okay? And I think amine antibiotic. So aminoglycosides, amine antibiotic. Precautions and side effects that you're going to want to know. Top two, you want to star, highlight, note: ototoxicity, nephrotoxicity. This can also cause nausea, vomiting, diarrhea in patients. Patients can complain of headache and even hemoptysis, okay? So nursing interventions, nursing considerations for this medication. Number one, star this, note this: you always want to obtain a specimen culture prior to the administration of the antibiotic so that we know what we are treating, okay? And what we know what we need to use for that infection. We also want to monitor for signs and symptoms of nephrotoxicity. We also want to monitor for signs and symptoms of ototoxicity. This is an assessment of cranial nerve number 8. Note that. Also, we would see things like difficulty hearing, patient complaining of tinnitus, balance issues, dizziness, things of that nature. And then we also want to assess for any type of superinfection. If you found this helpful, make sure you're following this page, save this video for later, and take a future nurse.